What is the Support Act? Have you ever wondered how the government is tackling the opioid crisis? One significant step in this fight is the Support Act, which stands for the Substance Use Disorder Prevention, that promotes opioid recovery and treatment for patients and communities Act. This law was passed in 2018 and represents a major federal effort to combat the opioid epidemic in the United States. The Support Act is a comprehensive piece of legislation that aims to improve prevention, treatment, recovery, and enforcement related to opioid use disorder and substance use disorders. One of its key features is the expansion of Medicaid's role in covering treatment services for individuals with opioid use disorder. This includes options for states to cover services in residential treatment facilities and pediatric recovery centers for infants affected by neonatal abstinence syndrome. Another important aspect of the Support Act is its protection of Medicaid eligibility for vulnerable groups, such as juveniles in public institutions and former foster youth. This ensures these individuals have continuous access to the treatment and care they need. The Act also requires state Medicaid programs to implement drug review and utilization safety measures. This helps prevent inappropriate opioid prescribing and supports safer medication management. Funding is another critical element of the Support Act. It increases support for community-based treatment and recovery programs. This includes grants for peer support specialists and recovery services led by individuals in recovery. The Act also mandates coverage under Medicaid for all Food and Drug Administration-approved medications for opioid use disorder, including buprenorphine, methadone, and naltrexone. These medications are part of a critical evidence-based approach to treating addiction. Additionally, the Support Act supports pregnant and postpartum women with substance use disorders. It allows Medicaid payments for services provided in institutions for mental diseases and increases funding for residential treatment programs tailored to their needs. The Act also establishes demonstration projects to increase the capacity of providers who treat substance use disorders, addressing workforce shortages in this essential area. From a liberal perspective, the Support Act aligns with core values such as expanding access to health care and protecting vulnerable populations. It emphasizes treatment and recovery over punitive measures, recognizing addiction as a health condition that requires comprehensive care. The provisions to enhance Medicaid coverage and fund community-based programs reflected a commitment to social support systems and equitable health care access. In practical terms, the Support Act has helped states improve their ability to treat opioid addiction, reduce overdose deaths, and support long-term recovery. It integrates medical, behavioral, and social services to address the opioid crisis as a public health challenge. This coordinated policy response at both federal and state levels is essential for tackling the ongoing challenges facing liberalism in the 21st century.